Which subgroup of patients is at risk of Harlequin syndrome? A. Severe LV dysfunction with abnormal lungs. B. Preserved LV function with normal lungs. C. Severe LV dysfunction with normal lungs. D. Preserved LV function with abnormal lungs. The correct answer is, preserved LV function with abnormal lungs. Which of the following substances is not filtered by a hemofiltration? A. Creatinine. B. Urea. C. Fibrinogen. D. Glucose. The correct answer is, fibrinogen. Chance of gaseous microembolism is highest during which of the following events? A. Aortic cannulation. B. Aortic cross-clamping. C. Rewarming. D. Decannulation. The correct answer is rewarming. Which of the following is not a cause of turbulence? A. Straight, long arterial cannula. B. Sharp turn to blood flow in oxygenator. C. Blood passing over rough surface. D. High blood velocity. The correct answer is, straight, long arterial cannula. Excessive back bleeding from arterial cannula to arterial line suggests A. Adequate size of the cannula. B. Good arterial pressure. C. Inadequate pump occlusion. D. Cannula tip is placed intraluminally into aorta. The correct answer is inadequate pump occlusion. Raised SGPT levels indicate A. Severe hemolysis. B. Liver cell damage. C. Blockage of intrahepatic bile duct. D. Myocardial cell damage. The correct answer is liver cell damage. Which of the following makes heat transfer inefficient? A. Low specific heat of the coil material. B. Thick-walled coils. C. More coils in the space. D. Slower speed of blood. The correct answer is thick-walled coils. The dicrotic notch on the arterial waveform reflects A. Systolic ejection. B. Isovolumetric contraction. C. Aortic valve opening. D. Aortic valve closure. The correct answer is aortic valve closure. In Harlequin syndrome, all of the following statements are true, except A. May be overlooked if the arterial blood sampling catheter is positioned in the femoral artery. B. May be overlooked if the arterial blood sampling catheter is positioned in the left arm. C. Converting to vein or venous arterial ECMO is a potential solution. D. Cerebral oxygenation is normal. The correct answer is, cerebral oxygenation is normal. Which of the following is not a feature of pump lung syndrome or post-perfusion lung syndrome? A. Intraalveolar edema. B. Interstitial edema. C. Atelectasis. D. Hemothorax. The correct answer is hemothorax. Histidine in HTK custodial cardioplegia acts as A. An enhancer of buffering capacity. B. A cell membrane stabilizer. C. Improves ATP production during reperfusion. D. An inhibitor of lactate production. The correct answer is an enhancer of buffering capacity. The role played by procaine in St. Thomas cardioplegia is A. Provides substrate. B. Immediate diastolic arrest. C. Prevention of reperfusion edema. D. Membrane stabilization. The correct answer is membrane stabilization. What are the advantages of using helium in IABP? A. High solubility. B. Availability. C. Low density. D. High biocompatibility. The correct answer is low density. During CPB, metabolic acidosis and decreasing mixed venous oxygen saturation are noted. The most likely cause is A. Hypothermia. B. Hypoperfusion. C. Hypercarbia. D. Low anesthesia. The correct answer is hypoperfusion. Which of the following factors in a circuit is not detrimental to blood? A. Low shear stress. B. Stagnation. C. Negative pressure. D. Turbulence. The correct answer is low shear stress. Which of the following ions is not present in ringer lactate solution? A. Potassium. B. Calcium. C. Magnesium. D. Chloride. The correct answer is magnesium. The technique of cross-circulation is attributed to A. Gibbon. B. Lilhai. C. DeBakey. D. Melrose. The correct answer is Lilhai. Which of the following parameters is not a feature of protamine shock? A. Fall in systemic arterial pressure. B. Fall in pulmonary arterial pressure. C. Fall in the heart rate. D. Rise in CVP. The correct answer is fall in pulmonary arterial pressure. After starting unilateral antegrade cerebral perfusion, cerebral SO2 monitored on left side falls by more than 20%. Which of the following is the most appropriate measure? A. Increase FiO2. B. Increase flows through the arterial cannula. C. Give head low. D. Institute bilateral cerebral perfusion. The correct answer is institute bilateral cerebral perfusion. What is the maximum molecule size that is filtered by hemoconcentrators or hemofilters? A. 10,000 Daltons. B. 20,000 Daltons. C. 30,000 Daltons. D. 40,000 Daltons. The correct answer is B. 20,000 Daltons. Filtration capacity of a screen filter depends upon A. Material used in the filter. B. Pore size of filter. C. Thickness of the filter. D. None of these. The correct answer is pore size of filter. After coming off CPB, if the purge line is left open along with arterial line left unclamped, the patient will have A. High BP with empty reservoir. B. High BP with full reservoir. C. Low BP with empty reservoir. D. Low BP with full reservoir. The correct answer is low BP with full reservoir. PCO2 during cooling is low because of all the following, except A. Less production of CO2. B. Increased solubility of CO2. C. Proportionately large gas sweep flow. D. Increased conversion of CO2 to HCO3 ions. The correct answer is increased conversion of CO2 to HCO3 ions. The major physiological effects of counterpulsation include A. Increased coronary artery perfusion, increased preload, decreased afterload, and decreased myocardial O2 consumption. B. Increased coronary artery perfusion, increased preload, increased afterload, and decreased myocardial O2 consumption. C. Increased coronary artery perfusion, decreased preload, decreased afterload, and increased myocardial O2 consumption. D. Increased coronary artery perfusion, decreased preload, decreased afterload, and decreased myocardial O2 consumption. The correct answer is increased coronary artery perfusion, decreased preload, decreased afterload, and decreased myocardial O2 consumption. What is the main difference between alpha-stat and pH-stat management of blood gases during CPB? A. Alpha-stat prioritizes O2 content, pH-stat prioritizes hydrogen ion concentration. B. Alpha-stat prioritizes hydrogen ion concentration, pH-stat prioritizes O2 content. C. Both prioritize O2 content. D. Both prioritize hydrogen ion concentration. The correct answer is alpha-stat prioritizes O2 content, pH-stat prioritizes hydrogen ion concentration.